It's winter of 2020. We're in the middle of a pandemic, but life is pretty good. We're just out here taking care of our community the best we can. Responding to a helicopter crash every now and again, no big deal. But we want to do more for our community in the time of a pandemic. So we get funding for a COVID rapid response program. Even without a global pandemic, getting healthcare in our community is an adventure. And it's not just because of snowy roads. We also have poverty, old age, and chronic illness. So we set out to support vulnerable populations by providing home visits in coordination with primary care physicians. But then the nature of the pandemic kind of changed, and the vaccine came out, which was great. But we realized quickly that we were living in a vaccine desert. In fact, I had to travel 240 miles for my doses. So we assessed the situation and could see that what our community really wanted and really needed was help. And it was help in getting vaccinated. So we adapted. We crossed into a new world, which we're not used to. With the funds from the Rapid Response Program, we're able to buy a digital data logger. We also used one of our refrigerators to store vaccines, and we applied to the state to get vaccines at our agency, which is not something that EMS agencies normally do. To date, we've held over a dozen vaccine events in our rural community. We've delivered over 2,500 vaccine doses, and about 20 of these doses were to people either in their home or in their car due to immobility or vulnerability. With the rapid response funding, we also created an EMS leadership development group. And in this group, we utilized some of our best learning from clinical scholars. To date, this group has met monthly and has explored ideas like peer coaching and the Multipliers book, just to name two things. As the person who wrote and submitted to this funding opportunity, what did I learn? I learned the importance of adapting to my community's need. And like plants that only grow when they're exposed to sunlight and water, leaders really only grow when they're exposed to the things that they need, a challenge and the permission to grow. And through this opportunity, we were able to offer these EMS professionals that ability to grow into the leaders that they are.